So, dear guests, welcome to the European Parliament. I think we can start now. First of all, my name is Andrey Kovatchev. I'm a member of the European Parliament, elected in Bulgaria, and I'm really very pleased and honored to be your host for the conference today in the European Parliament in Brussels on a very important topic, how we can fight health inequality in Europe and equal access to health care. Organized and co-organized by the European Patient Forum and by the National Patient Organization of Bulgaria. I welcome here the colleagues in front of this hall. And I would like only to start with a few words. We, as everybody know, European Union is at the moment in a very difficult financial and economic crisis. We here in the European institutions are dealing with the crisis management, with thinking on how to make Europe fit for 2020, how to make it how to have more advantage in front of the global competition. And for sure, one of the most important is always related to money. So multi-annual financial framework is the key topic for the Parliament for the next maybe a few months, if we cannot have an agreement till next week in Strasbourg when this is on the topic on the agenda. But Europe is also the citizens of our continent, and we are going to talk today on how to use the European integration, the European solidarity, also for benefits of the European citizens. We cannot talk only about common agricultural policy, about cohesion policy. What is cohesion policy? To fight inequality in the different regions of Europe, but this inequality is not only infrastructure, not only environmental issues or competitiveness of our small and medium enterprises, but also is related to health infrastructure. Welcome to my dear colleague from Romania, Mr. Petru Luhan. And very important, this topic is not only related to the new member states. This is so important for the whole Union, and to find the key issues, what I hope after the launching of this platform, what we are going to do today in the European on board all the stakeholders, the patient organizations, which are the key moving force in this topic, then the medical doctors, the pharmaceutical industry, the pharmacists, the decision makers from the different European institutions to have maybe a short list, if you like, the most important and effective measure which European Union can introduce in the priority of the Union to fight inequality, to fight this access to a quality health problem which we are facing in the member states. I'm not going to give a lot of speeches, a long speech. For me, it's important that I and my colleagues can offer you a platform where you can give your ideas, your proposals, and we as elected and legitimate representative of the European citizens to find a way this to be realized together with the European Commission, together with the Member States, together with the European Council. At the end of the today event, we will have a chat also between the policymakers and between some of the colleagues. I already had discussions with MEPs from different Member States, trying to attract them for this initiative and to make this platform MEP platform workable, but this can happen only with your interventions, because we can listen to you, but we cannot give the ideas how to deal with this problem. So that was my final words. I wish a lot of success of the brainstorming of today's session, and I would like to give the floor to the co-organizers, to the European Patient Forum, and to Mr. Tomasz Skalakowski. I hope it was close. Right, close. For some welcome words also from the European Patient Forum.
Thank you, Mr. Kovatchev. Dear members of the Parliament, my colleagues in the panel, and all the guests in the audience, I'd like to welcome you on behalf of the co-organizer, European Patients Forum, of this event. And I'm really glad that the room is filled in. It means the subject that we decided to tackle today, it's important, and it's quite high on the priority of subjects in your activities. It's also thanks not only to Mr. Kovatchev as an initiative, but also to, beside the European Patient Forum, to our friend and colleague in the board of European Patients Forum, who is sitting on the right, Stanimir Hozurdayev, who has that a lot of energy and initiatives to tackle that subject. So thank you, Stanimir, for motivating us to bring in this for the further discussion. But as a European Patients Forum, it's our one of the most important roles to bring the patients' subjects to the European discussion. But it's not only to bring that those subjects for the discussions, to present the patient voice. It's also to help our members, which are disease-specific umbrellas or national umbrellas, to tackle those subjects and make them effective on a national level as well. Because this is what we do say about this, and that's what we will do say today. It's important to do it on the Brussels level. But most important is to bring it down there to the national policies and to local areas that will make an effect. Inequalities in health, it's one of those issues which we consider very important. I just will share with you one situation. Today when we were all coming in here to this building, you will see the stands made outside by the Croatians. They will be in a few days a member of the European Union. It's a fantastic thing. I do remember almost 10 years ago when most of those countries from the Central European area have joined the European Union. It was 2004. Now we're almost 10 years after that. We are so happy that we did that. When I see Croatians presenting themselves today in front of the Parliament, it's such a great feeling. You know? People can do amazing things. And we're here today, we've met to do that kind of amazing things. It all depends what we will do with them. It all depends on all of us here in the room. When we look at each other, then we will see that each of us has the responsibility to do something. In different area, different way, but to do something. There's all of that, it's no need to say anything more. Just entering the building again, another situation happened. I've met the former president of the Parliament, European Parliament, Jerzy Buzek. And one thing that he pointed out is those signs that was hanging on the walls of the Parliament building about the solidarity, how it was started. There's a short explanation. Please do and see it. It was in 1980s. We broke that socialist system that existed in that area of Central Europe. And it all happened because 10 million people joined the solidarity movement. And it started in Poland 25 years ago. So let's join the solidarity movement in the inequalities, in fighting inequalities. And there will be a few years after that, maybe sooner, maybe later, then we can make a difference. But we have to do something. Mr. Kovatchev, in your hands.
Dziękuję bardzo, Tomasz. Thank you very much. And now I think we can start with the first session, and I'm honored and pleased to give the floor and to be the moderator of the first session of Madame Nicola Bedlington. She's Executive Director of the European Patient Forum. Please take over.
Thank Thank you. Good afternoon, everybody. This session will actually explore data around health inequalities. And my colleague Stanimir from NPO will give us a summary of the conference, the first conference on health inequalities from a patient's perspective that took place in Sofia last September. And we'll also be looking at the outcomes of a survey that was undertaken with patient organisations in the new member states and candidate countries. And then we'll be looking at two specific case studies exploring access issues from the perspective of two very different disease areas. We're under a little bit of time pressure, so you'll forgive me if I just move on immediately, give the floor to Stanimir to give an overview of our very exciting conference last year in September.
Thank you very much. Dear members of the Parliament, dear guests at today's conference, I'm really pleased that we are today here in the European Parliament and starting talking about an issue that I know all of you are interested in, and you have been talking among your colleagues for years now. But before I tell you how the whole story started, I would like to say a few words about myself for those who don't know me. I'm Stanimir. I'm a person that was born and lives in Bulgaria, one of the newest EU member states. One of those EU member states that's considered to be the poorest, one of the difficult countries and the difficult brothers in the European Union, one of the countries that is quite challenging. Actually, I'll tell you a story about two realities that I've started living. Long time ago, when I started being involved with the patient movement in my country, I started being part of the reality in my own country. A reality where being a patient is a tough job. A reality where being a doctor is a tough job. A reality where being a policymaker is an extremely tough job. Staying there, right now, I'm the chairperson of one of the biggest patient organizations. And I would just like to ask you now to look into the room and to see how many people are there. I can tell you that there are about 80 places, so we are about 80 people in the room. The organization that I'm chairing right now has exactly 85 member organizations. Behind each of those 85 member organizations, there are hundreds and thousands of patients with different conditions, with different diseases. Those patients are facing my own reality every single day. And this is one world where I have to live and where I have to really tackle with the problems of all these patient groups and those people who voted for me and put me to take care and to take this chair, being their chairman of the National Patients Organization. Now I'll tell you about the other reality that I started living when our organization joined the European Patients Forum. I also have the honor to be the executive director of the European Liver Patients Association, where we are tackling with lots of problems, but still have the opportunity to travel here and there, meet different stakeholders. Then I started living in the second reality, in the second world, coming in these beautiful buildings here, talking about beautiful initiatives, talking about a wonderful world that we can build all together. Then these two realities actually started becoming really different, like living two different lives. Every time when I go back to my country, all those 85 patient groups with their different patient problems and with the problems of the doctors and with the problems of the policymakers, and then coming back here and talking about the other world, about different beautiful initiatives that at the end of the day, many people have the feeling that they really need something more to be done in order to change people's life. Then I thought, probably we are in a situation where maybe not only Bulgaria has such problems. And luckily, I had really the opportunity to exchange ideas and different perspectives with my colleagues from Poland, from other countries, from the new EU member states, from countries that are from the old EU member states, like Greece, a neighboring country of us, some other countries. And with the crisis hitting, we understood that those problems are actually everywhere and hitting everyone. And now we are facing a situation where we simply don't have any other possibility but finding a way altogether to tackle all these issues. That's how the idea for doing the first conference on health inequalities from patients' perspective was born about a year and a half ago. And that's how in Sofia we gathered together about 15 countries from the new EU member states. Luckily at this conference we had quite many policymakers, also from the European institutions, but also from the member states. It was surprising for us how many ministries of health reacted and sent to us their representatives to talk. And it was obvious. We all are coming to a phase and stage that we acknowledge that we cannot tackle the problems alone. We need to better collaborate. So now I will ask my colleague to put a very short video that will give you some inspiration from the Sofia conference, and then I will finish with a few words and we can continue to get with the other speakers.
On September 2021 in Sofia, Bulgaria, took place a conference entitled Policymakers and Patients Creating the Change. The theme of this meeting was to address for the first time the challenges of health inequalities in the southeastern region. The event was initiated by the National Patients Organization in collaboration with the European Patients Forum. Among the key speakers and supporters of this initiative were Mrs. Desislava Adanasova, Bulgarian Minister of Health, Dr. Marian Cesarik from the Croatian Ministry of Health, Dr. Andrey Kovatchev, Member of European Parliament, and other members of the European Parliament. The conference aimed to openly address health inequalities in Europe and to influence dedicated action among policymakers for curbing severe discrepancies in healthcare throughout the European Union. Selected speakers provided background information and recent data on health inequalities, explored country-specific challenges and good practices, and shared information about the results of the European Union cooperation in terms of health inequalities. The conference concluded with the adoption of a resolution which calls for placing higher priority on health inequalities by European policymakers. The reduction of health inequalities forms a major pillar of the European Union health strategy, Together for Health, and a major element in achieving the goal of inclusive growth of the Europe 2020 strategy. Upon an in-depth evaluation of the conference's workshop sessions, the National Patients Organization elaborated a questionnaire which will be used for further probe the perception of patients across the European Union on health inequalities from their region. The main objective of the survey is to address current major issues and to outline opportunities for improving the healthcare environment, both within and outside respective healthcare systems. At the end of the second day of the conference Policymakers Creating the Change, several stakeholders addressed their national governments and the European institutions, sending closing messages with respect to health inequalities within the new European Union member states.
Reiterated on many.
So, this was just a very short video to give you the feeling and the enthusiasm that patients and people from that region had there in Sofia. This actually inspired us and actually gave us the opportunity to start looking what else can we do. Shall we only complain about the situation? Shall we only expect that someone like the European institutions or our governments will do something, or the pharmaceutical industry will do their drugs more available, or our politicians in the parliament will do something? Or we can do something together in order to find solutions that simply work. So that's how we started focusing more and trying to collaborate with other stakeholders. Today, you will have the opportunity to listen to the first results of this patient survey that we had among patient leaders, showing what exactly the major problems that patients see, what are some of the possible solutions that they see. Then we found out that many of the stakeholders are having quite many initiatives on access, health inequalities, how to expand it, pricing, all the different issues that are going around. It's the European institution initiatives, it's the member states' different initiatives, it's the patients that have their own initiatives, it's the experts and the doctors that are doing something, it's the industry that are working on these issues. How about if we join forces and all that energy and really come to the solutions that can change the situation? This is the reason why we are here, and I really expect that following this conference we will start a couple of other actions that will, at the end of the day, change the situation for all European citizens, because the problems simply don't stay in my country. Because the problems being there and not having a proper solution, they move everywhere. Because if you are a person with a chronic condition and you cannot get your treatment in your country, or your child needs that treatment, you simply find your way to go and find a more secure system, or find your way to find your treatment in a country where it is available. And many other issues and problems around that. But I'm sure that we are here committed to find the solutions together. Thank you.
Thank you very much. Thank you. Before I give the floor to Emily Peasgood, I'd like to invite Mr. Lukin from the Romanian MEP, who would like to make an intervention, a short intervention on some news from yesterday.
And maybe to say first congratulations to Petru, because he got the MEP award in the category health, especially in the fight against health inequalities. So Petru, congratulations again, and please.
Thank you so much, Andrey. Well, first of all, I would like to congratulate you and the co-organizers for organizing this event, which is really, really important and coming to a proper time, because the inequalities in the European Union in terms of access to healthcare and to quality healthcare are so high at this time. I'm coming from Romania, where the situation in the healthcare system is not at the average level of the European Union, and it might be similar in Bulgaria. That's why we have a common scope, a common goal, to fight together with the colleagues from the European Parliament, but also from the European Commission, in terms of eliminating the differences between the member states. Well, I'm so proud that yesterday I got the MEP award on the category health for 2013. One of my actions, but also even together with Mr. Kovatchev, is that we fight together against many diseases like cancer. We fight together to improve the infrastructure in the medical area. We also believe very much in the new concept of personalized medicine, and the most important goal is to eliminate the differences between the member states in terms of access to treatment. Well, I was also fighting within my party at the time as we were governing in Romania, but also now putting pressure on the government to improve the situation, but it's not possible without the help and the support of the European Commission and without the common legislative framework at this level, at the European level, and financial support. Don't forget about the research and development money, which is available for those who are able to do research and development. We have FP7, not less than 6 billion euros only on health, which is not taken by the entities which are able to do so. We as politicians, we are not able, we are not allowed to do so. What we can do is to inform the people. I also had some campaigns in Romania that relevant organizations apply for money. We will have 60, we have for 2007-2013 available for research and development. We will have even 87 billion euro for 2014-2020 available for research and development. A big part of it will be for health issues. So my advice is that everyone, I'm sure we have a lot of representatives of different NGOs which are able and eligible to apply for this money. And my advice is to go for this money, to take this money from Brussels directly, and to invest as much as possible in achieving this goal, which is a common one, eliminating the differences in terms of access to quality healthcare. And that's why, again, my congratulations to organizers. I will support this as much as I can, and we will have for sure also common activities in this regard. Thank you so much.
Thank you very much. A very, very clear message, and we'd like to congratulate you on the award. Thank you. And now I'd like to give the floor to Emily Peasgood from the organisation Insight, who's been doing some analysis work for us in relation to the survey. Emily, the floor is yours.
Thank you very much. It's my pleasure to present the results of the research that we did amongst patients. As Stanimir mentioned earlier, the real aim of the research was to just hear the views of patients, give them an opportunity to tell us what they think of the current situation, to tell us what they think are the urgent issues. So we went out and we targeted people with chronic conditions or carers of those with chronic conditions, and we were targeting proactive patients, members of patient organisations. We recruited them via two different routes. So one, we spoke to patient organisations and got the contact details of patients and then sent them the link on an email so that they could complete it. The numbers there were perhaps a little bit disappointing, so we supplemented the sample by posting the survey on various patient websites. Obviously, everyone was screened to make sure that they were patients or that they were carers of patients. So everyone did it online, and we had it open for about 3 months. But the sample in total, it's 286 across the 15 markets, and if you can see the numbers there, varying numbers across the different markets. So today, I'm just going to give you a very top-line output of what we learnt. We compared the two samples from the two different recruitment routes, and we were comfortable that there were no significant differences. So we were able to put both samples together, and also, obviously, in light of the numbers, we're just going to talk about a total level. So I think the big takeout from talking to patients from these patient organisations is that they think that access to quality healthcare is a big problem. When we talk about access, it's a range of issues. So waiting times for products and services, access to screening and prevention policies, availability of products and services, both at home and abroad, and access to good quality hospitals, and access to good doctors, and getting a good quality service from those doctors. Overall, patients and carers are worried that the impact that the economic crisis in their country has had on healthcare. I don't know if you can see the numbers, how clearly you can see them, but we're looking here at how the percentage of the sample that agreed with each of the statements. So looking at whether they feel that due to the economic crisis, the government is actually decreasing budget for healthcare. So you can see that almost 3/4 of the sample felt that that was the case. And the one I wanted to focus on today, at the bottom, the number of new drugs which are entering the market is decreasing. So again, this idea of access to new treatments, over half agreeing that that was the case. almost half of our patients and carers feel that waiting time for medicines, products and services has worsened since joining the European Union. We gave them a long list of issues and asked them to what extent they think they had improved or worsened. And, I mean, we're focusing here today on the issues that they think have worsened. So you can see there that a lot of it is cost issues, price of medicines, co-payment level, reimbursement level, but also the fourth one down there, as I just mentioned, almost half of the patients and carers that we spoke to felt that waiting time for treatment, and by treatment we mean medicines, products and services, has worsened since their country joined the European Union. So in light of that, we then asked the patients what they felt were the key issues that they think are particularly urgent and need to be addressed. And I think just by the sort of amount of red on the slide, perhaps understandably, the patients and the carers felt that, you know, a lot of the issues were urgent. So here again, we're focusing on the issues that the sort of top answers. So almost the entire sample, 97%, said that they felt that ensuring a sustainable funding of the healthcare system was urgent. And then you'll see, if you can read them, that all the issues below that, where the bottom one is still 88% of our sample of people feeling that the issues are urgent. So improving waiting times for treatment, developing more screening and prevention policies, making medicines, products and services more available, improving the health infrastructure. By that we're talking about the equipment and the conditions in hospitals, improving the quality of service provided by doctors to patients, and improving access to new therapies. So, you know, and the dark bars there as well are the percentage who said that these issues were very urgent. So there's a long list of things that people feel are urgent. So essentially, as you'd expect, the patients and carers want to see changes to improve their healthcare situation in their country. We gave them a list of scenarios and asked them to what extent they felt if that scenario was implemented, whether they think it would have a significant, improve the situation in their country. And the one that came out as the sort of top answer there was introducing the right of patients to receive treatment abroad at the expense of the national health insurance, assuming that it's not available in their own country. But the other scenarios there, implementing affordable pricing, specially tailored programmes to meet the specific needs of patient groups, and additional EU funding for low-income countries to be allocated to health systems reform. So it's been a very quick run through the results. I will conclude in a second, but also to say we do have the full results and we can share those with you. But in the interest of time, I just wanted to finish with a couple of final thoughts. So the patients we spoke to, the proactive patients from the patient organisations, they do feel that the economic crisis has had an impact on healthcare systems, and subsequently it's having an impact on their lives, the lives of patients. The biggest concern at the moment for the patients and the carers is access to healthcare, and there we're talking very broadly about hospitals, doctors, infrastructure, medicines, etc. So a wide issue that they are concerned about. So this suggests that new approaches to increase access and sustainability of the EU healthcare systems do need to be explored. Particularly with, for example, things like better collaboration across different markets, exchange of best practice where, if something's working well in one market, one country, quality standards and sustainable pricing. So that was all the slides I had, and I hope I didn't take too much time, Stanley, but thank you.
That's fine.
Thank you. Thank you, Emily. That was great. A very clear overview. Unfortunately, we don't have time to pose questions to Emily, but there'll be time in the next session to have a discussion. I'd now like to welcome Achim Katz, the Policy Director from the European Liver Patient Association, to give us a short case study in relation to access to quality health care for hepatitis patients.
So thank you very much to give me the floor, and thank you very much for the invitation. I'd like to present you a very good case study, I think, regarding to the topic of this conference. So next slide, please. So we can switch over this. I'm the policy director of ELPA, and ELPA is a patient umbrella organization in Europe. We have now 31 members from over 30 countries now, and we promote the interests of liver patients. But the important thing is, next slide, that we care most for the field of hepatitis, viral hepatitis, because with viral hepatitis in Europe there is a dramatic. So the problem with virus hepatitis is that we have a virus without any symptoms. So you may feel tired, you may feel not so concentrated, but these are the only symptoms to have hepatitis C. And the problem is this is the biggest risk factor for liver cancer in general, but also for the end stages like cirrhosis, and this also leads to other diseases like cardiovascular diseases or diabetes. So hepatitis C is a very, very tricky disease. And so our long-standing advocacy goal is for ELPA that you have to know that we have around 500 million carriers around the world. This is quite a lot number. And we estimate that in Europe we have something we do not exactly know because the data of the ECDC is not so accurate, something between 50 up to 120 million of Europeans are infected with hepatitis C. But the problem is we have a very high undetection rate of around 90%. That means only 10% out of this big, big pool knows about their condition. And this is a dramatic thing of hepatitis in general. But if you are diagnosed, it is easy prevented, diagnosed and treated. But if it goes undiagnosed, so many patients will die a slow and painful death. And you have to know that the death rates of hepatitis C is worldwide, but also in the US and in Europe, higher than HIV. But on HIV, there's a lot more of attention. So our goal is to promote the early diagnosis, but we have to rethink a little bit our goal because of the economic crisis. So the hepatitis plans, some are adopted and implemented. I think when ELPA was founded in 2005, we were very happy to see that France and Scotland were some of the bigger players in the field of hepatitis. They have really developed a very comprehensive national plan. But because of our activities, so we have achieved a lot, I think, in the last years. So there is, in 2013, it was adopted now, I think last week or 2 weeks ago, Stanimir, in Bulgaria, the hepatitis plan. Now it is development in Croatia. In Germany, we launched in July this year, in Ireland and Italy, but also in the development process in Romania and Greece. And so when we produce a slide, so the update is last week we have launched the Romanian hepatitis plan. So, and you can see, and this is a dramatic of when we speak in health inequalities. What you can see here is a slide, the development of the treatment options we have for hepatitis. So when hepatitis C was detected in 1991, we have only cure rates around 7% with monointerferon 3 times a week with huge, huge side effects. And then in combination with pegylated interferon and ribavirin, we have 2011, so the standards that we have around 50% cure rate. SVR. And that's really, really good. But now, and I think this is a milestone in medicine in general globally, we have now chances to cure hepatitis C from next year on in cases up to 95%. So that means if you are detected, you have a treatment, 3 months, 6 months, low side effects, and you're cured. So big, big chances for all those who suffer of hepatitis. But now the problem. Next slide, please. We have made a short survey amongst European citizens, but also doctors and patients, and the result is, and this is something that Stanimir mentioned, we have quite different realities. On the one hand, we have really good medications, but on the other hand, we have no access to these medications. And we can map this throughout Europe, and only in 5 countries in Europe you have unlimited access to the new compounds. But the new direct-acting agents are most needed in those who have highest prevalence, and those more the eastern parts of Europe and most southern part of Europe. And these are some quotes. I just want to read 2 or 3 of them. So the problem of the costs with the new treatments. So, for example, a doctor of Lithuania told me, so the cost of the new drugs are higher than the average price of a house. So do you really think, Achim, that the government will sponsor 300,000 houses in my country? No. Or the other thing, a doctor in Romania, of course, the new treatments are officially approved, and this is very important for you to know. EMA has approved it for complete European countries. But without private sponsorship of companies, I would not have the chance to see them in real life. Or, for example, Italy, one of the founding members of the European Union. So they do not have real access to the new compounds because of economic crisis. And even in Portugal, it was, in the first phase, they were approved, but then they refused because of the costs of the new treatment. So, and that leads for new solutions. We need new solutions to face this problem. So from the patient's perspective of ALPA, it is really important that innovative drugs has to be launched in all countries. And we have to establish a voluntary scheme, so for the industry, but also for the individual member states, to agree a price that reflects the ability and the willingness to pay. So we have really to look to a new way to set up prices. And we need the government to guarantee to treat access for patients in need. This is also very important, and I think much more important if we talk about this. So please, dear governments, do not export the lower prices drugs to countries where you can sell them for more, because this happens in Europe. So the next slide, please. So our helpers call on the EU policymakers. We need to fight those health inequalities and overcome those sex problems. We need new solutions, and I'm very thankful that we have here now the kickoff. And all the relevant commission services, and I think this is also important. It's not only the DJ Sanko, it is also the DJ Enterprise and the internal market. They need to work together to face this problem. And if they create a kind of task force with the supporters by the presidential troika, which are served by the European Parliament, I'm sure we find good solutions. So, thank you very much, and I hope we have good results at the end of the day.
Thank you. Yes, please, go ahead.
May I only say welcome to my dear colleague Vladimir Uruchev. He's also a member of the European Parliament from Bulgaria. Welcome, Vlado.
Okay, thank you very much, Achim. I think that's really helped to bring to life the whole challenge of health inequalities in one specific disease area. It's now my pleasure to give the floor to Eric Breeze, who's actually from the Europe OMO organisation, to talk about some of the challenges in relation to access in oncology.
Thank you. Thank you, Nicola. Well, if you don't treat hepatitis C in time, then you get cancer. So this is a smooth going over to oncology. And what is needed not to get liver cancer is early detection. You want to talk about the inequalities in Europe, it starts with early detection. For early detection, patients need to know what's happening in their body. This means that they need to have education on diseases. Well, education on diseases, for one thing, is not equally distributed throughout Europe. So it already starts there. Education on diseases, on health, is something that needs to be done in an equal fashion across Europe. Let's go on. Let's go to diagnosis of a cancer. To diagnose cancer, you need very sophisticated means. You need special laboratory equipment, special lab tests, genetic testing, PET scans, magnetic resonance imaging. These are not distributed through Europe equally. They are very expensive equipment. You go further, then you want treatment. Treatment is also very, very difficult. It is very special and requires equipment, or it requires very special, sophisticated surgical techniques, robot-assisted surgery, not available everywhere. I can go on like this. We go to treatments with medicines. Medicines, you just heard how difficult it is to get new drugs to the different countries in Europe. And we did not yet speak about personalized medicines. In the future, we will no longer speak of prostate cancer, which is the main cancer for men. We will speak about the 20 different varieties of prostate cancer that all have their own specific drug. How on earth are we ever going to pay for that? That will be a real big, enormous, gigantic challenge. So the inequalities are throughout the disease process. And in oncology, there's one phase which is even unequal, that's dying. Palliative care. Do you think palliative care is the same in all countries in Europe? I don't think so. In some countries, it's even not accepted that the patient who has pain does not need to have pain. We have the tools, we have all the things we need not to have pain. Why don't we give it to all patients across Europe? This is again a question of education. We need to educate our medical professionals. They have to accept that. They don't always. And sometimes the political world has to play with them and has to give a little push in the back so that these inequalities, which are easy to solve, should be solved. Then are there solutions to this? One solution, and that's probably going to strike you a little bit, is early detection. If you count the cost of a cancer, the sooner you treat it, you can cure it. If you cure a cancer, it's cheap. An operation of prostate cancer costs about 2,000 euros in this country. Treatment with some of the new medicines costs about 3,000 euros for a month. And these patients need that for a long period because our cancers all become chronic. Chronic means time, a very long time. And after the first treatment, the second treatment is needed. We go into chemotherapy, very expensive, the new drugs. And we are not yet speaking about personalized. So early detection, get the tumor when you can cure it, not when you can only control it. And in this sense, it's a pity. And I know there's someone from my country, I'm from Belgium. For prostate cancer, we no longer reimburse the cheapest screening test or detection test, PSA, that is available. We no longer reimburse that. So patients have to come now with advanced disease. Because usually a cancer in its early stages, it doesn't cause any symptoms. You just live with it. And you have to recognize the very minor symptoms. And the last thing I would like to say about possible means to get this thing under control, we need treatment in expert networks. And these expert networks, I haven't spoken about the 184 different kinds of rare cancers. Do you think that in every country in Europe there need to be 184 expert centers for these cancers? I don't think so. We should work together and get expert centers across Europe where the patients are treated in an expert fashion. They will require much less equipment. They need equipment for the network. Move the patients to the equipment if it's too expensive to bring the equipment to the patient. And that's the same for the big cancers too. Do you think that a surgeon who does 2 prostatectomies or 2 breast surgeries in a year can do a good job? Personally, I don't think so, although they think. I will stand my case here and give the floor back to Nicola.
Thank you very much, Eric. Well, I hope this first session has helped to set the scene and to give you the context and also to give you a sense of how urgent and how critical the issues actually are. And I'd like to now give the floor to Andrey to moderate the next session in which we will hopefully explore some solutions. If you can just bear with us for about a minute while we change the panel, that would be great. Thank you very much.
I would like to invite the panelists for the second session to come here in front. This is Madame Desislava Dimitrova, Mr. John de Kock, sorry, and Madame Natalie Case. So, ladies and gentlemen, we are going to the second session, and we are on the stage of possible solutions. This session explores the way to create equal access to treatment and care in the member states. Panelists will share their insights on the possible solutions to expand access to quality healthcare in Europe. I would like to give the floor first to Madame Desislava Dimitrova. She is chair of the Standing Committee of the Regional Committee of the World Health Organization, and she is going to share her insights on collaboration and best practices sharing between the EU member states. Ms. Dimitrova, the floor is yours.
Thank you, Dr. Kovatchev. Distinguished members of the European Parliament, guests, it's such a great pleasure to address this wonderful audience. I will speak about two topics. The first one is a framework for collaboration. I have two hats right now. One is chair of the Standing Committee of the Regional Committee. The Regional Committee is the decision-making body of all member states in Europe for health-related matters. Those are members of basically ministers of health. And the Standing Committee is the body comprised of 12 countries. Bulgaria was currently elected to be chair of that body to steer the works of the WHO for the 1 year between Regional Committee and Regional Committee on a European level. The equivalent, global equivalent, is the World Health Assembly. So in the past almost 2.5 years, all member states of the European region developed a strategy called Health 2020. It's a European policy for health and well-being. And that is the framework that European countries are being guided for in terms of their health policy. EU countries have Europe 2020, but as a whole of Europe, I'll focus on the Health 2020, the framework that was developed by the member states of the World Health Organization. After that, I'll move to the second topic, which is more exciting, which are the practical suggestions of how we can implement that framework and how we can move forward to a more equal Europe. So first, why the World Health Organization decided to develop the Health 2020 strategy? Well, because even though there's such a great improvement of over 5 years in life expectancy, there's still great inequality. The screen is very small and we all know that data, but if we look at the Commonwealth of Independent States and then compare with EU 12 and EU 15, we would see the great disparity in life expectancy. So even though there is a great improvement in health outcomes across Europe, they're very wide among countries, and within countries, if we look at that graph within countries, we would see the exact same among social groups, among regions, etc. So Health 2020 said, okay, after much collaboration and discussion, countries came to think about what should be our strategic goals. And one of them was to improve the health for all, but not just improve the health, but improve the inequalities in the health. Because if we are just focusing, it's very easy to focus on one target population and achieve very good health outcomes. But unless we do it for all, then the success is really not meaningful. So the first strategic goal was to reduce health inequalities. And the second one was to improve leadership and participatory governance for all. That was a very debated topic because many say, well, it's the ministers of health job to improve the health of its population, because that's, he's a minister of health. The other one is a minister of the environment. The environment is what he should care about. But a consensus was reached that unless we have health in all policies and unless we engage all stakeholders, we're not going to get better outcomes. So a very big goal of this strategy relates not to the health-related people who are in the health sector, but really about the whole of society and the whole of government. And we defined 4 priority interventions: investing in life through a life course approach and empowering people. Here it was very much about the fact the data that about 80% of the expenditure for health goes to people above the age of 60. So the idea is to start investing earlier so that there's more interventions on prevention. Tackling NCDs and communicable diseases that was already at the table before the development of the strategy, then strengthening public health systems and creating resilient communities. So these were sort of the categories for interventions that were defined in the paper, and after in the strategy, and after 2.5 years of debate, it was adopted this September. September 2012 at the Regional Committee in Malta, which means that all countries in the European region, not just EU, but all European member states have committed first to improve health inequalities, and secondly to create a governance or and a leadership that would lead to that particular outcome. Now, the future plans are that this document, this strategy, becomes a part of the global agenda, not just the European. As you know now, the Millennium Development Goals of the United Nations are coming to the end of its planning, which is 2015, and we need to come up with new Millennium Development Goals, or some say that they have to be Sustainable Development Goals. And there are two groups of health-related stakeholders who are talking about what those goals should be. And Europe is very much advocating that we have only one goal, and it's universal health coverage. Because unless and until we have access to affordable health care for all citizens, we cannot really talk about anything else. Other stakeholders are saying, well, actually, you know, universal health coverage is a means to improving life expectancy. But if we, again, focus on life expectancy, we're going to miss out on health inequalities. Health expenditures drive a lot of people into poverty. So we need to come up with a goal, with a common framework for the whole world, and Europe is very much advocating for that it be universal health coverage. That though there was a lot of debate, should it be called universal insurance or universal health coverage, and it seems the debate is going to be focused more on the universal health coverage, not to talk about insurance per se, because I guess there's the social insurance, there's a lot of lost in translation aspects of that. And then the approach to achieve the implementation of these values, of these strategies, to create a partnership, and that's really stated out very clearly in the strategies. It's about partnership among governments, among sectors, and among institutions and stakeholders. And the strategy was actually developed about a year ago, but the reason why it was not adopted in 2011 was because member states, when they came at the regional committee, they said we don't want to adopt a strategy that doesn't have a very well thought out framework for monitoring. So for 1 year, there was a group of members from different countries developing indicators to measure the implementation of the strategy. And really the idea was to not reinvent the wheel, but use all the data that is already currently collected globally, and use it as group it in a way, that's why they were called headline targets, group it in a way that it's measured without creating new requirements for new data to be collected. So that is the framework from which we're starting to work towards a more equal access to healthcare and toward a partnership. Now, I'll move to the second part of my presentation, which is about practical suggestions for global and local implementation. And I'm not going to go to the slides that I prepared, just because I want to talk about something very exciting that took place last night that sort of changed the way I thought about the next step of my presentation. Last night there was an informal dinner among some key stakeholders, and it was exciting not because of the food that Belgium offers, but because of the company and the ideas that were born there. a lot of us have been speaking about the fact that for a very long time we're talking about the same stuff, that there has to be equality of access. We come and we say, well, we need support from WHO, we need support from the European Commission, we need support from the industry, but we seem to not be able to really move forward along this agenda. So an idea was emerging, has been emerging for a while, but it was more clearly articulated, and it kind of clicked in my mind last night about forming a more formal partnership on with a specific task on improving access. And the way I imagine it, and some of the participants in the discussion imagine it, is really coming up with an agenda about what are the concrete steps that need to be taken in order to improve access. But even before that, as Emily was talking earlier, defining what access really means and what it is that we as a partnership would define as access. She gave in the patient survey a few definitions as access to care, access to care without waiting times, etc. It could be access to all kinds of medical services, or could it be access to medico-social services and home-based services? I feel like this partnership needs to define the scope of access at this point and maybe in the long term, and then define the activities that need to take place to ensure that access, activities that we as citizens, as governments, as NGOs, as a commission, as WHO, everybody from their institution needs to take, and then define a very clear monitoring framework, maybe basing it on the framework that already is defined in Health 2020. There is an indicator that measures health inequality, and that has been developed based on very extensive stakeholder discussions, so maybe that could be used as a stepping stone for defining the monitoring framework. But these were, so this is the very exciting idea that came last night. And in fact, as we were exiting the dinner, Mr. Barroso was there. We thought that he had come to witness the elaboration of our idea, but he was there for other business. We debated sharing with him our enthusiasm, but then thought we would leave it once we get greater support. But we did give a nice, healthy wave at him. So with that, I will conclude. Thank you for the attention, and I look forward to a greater discussion on this and your feedback on this idea about developing a partnership for collaboration on improving access. Thanks.
Thank you very much, Ms. Dimitrova. And now I'm going to our next panelist, John de Kock. He is from the General Administrator at the National Institute of Health and Disability Insurance in Belgium, and he's going to speak on sustainable pricing system and how to expand access to medicines in Europe. And one only issue, we have a bit limited time, so
of course, I saw already the signs. First slide, please. Okay, when you are looking the last weeks what was published about access to medicines, but access to healthcare, you're impressed about the interest which is expressed by this slide. Some weeks ago we saw an access to medicines report. According to the authors, it's about developing countries. We have the publication of the European Public Health Association. We know that the first week of June, the Parliament of the Council of Europe was also discussing about health as a human right. And recently a patient review published also some information about the effect of the crisis on access to medicines. It will be my scope. It's a little scope. We have to be aware that the question of inequalities in health is of course a broad one. What I want to do and explain to you is of course not to have an overview of all the problems of access and inequalities. We have to make a distinction between these elements which are into the health systems and which are out of the health systems and are related to other health determinants. And we have also to make a distinction what can national governments do and what can Europe do. And I will focus a little bit on what we can do together in Europe as a whole. Next slide, please. When you look to the conclusions, and it's difficult readable, I think of the survey, it was very clear that the answer, how to obtain greater access to medicines in recession-hit and poorer countries, need action. And the patient view, which is another survey which was executed recently, set 7 points, a roadmap of 7 points. Get greater transparency about drug pricing mechanisms, and when I look to the surveys, we see that improving access to innovative therapies is also something which is often mentioned. Transparency and the institution of fair pricing, greater dialogues between all stakeholders, greater sharing of intellectual property, compassionate use programs, greater consideration on the impact of marketing campaigns, and the subject of access to medicines should be handled in the pharmaceutical sector by the senior management. Belgium, when we had the honor to be sharing the presidency in 2010, the second half of 2010, launched a wake-up call in some sense to make valuable, innovative medicine accessible in the whole European Union, knowing that we are confronted with a paradox between fostering innovation, investing in health on the one side, but also creating access and guaranteeing access and thus solidarity on the other side. Next slide, please. On basis of this presidency and the conference and the papers we made about it, it was decided that it should be examined and based on principles of solidarity, in which way economically and viable and efficient approaches to facilitate availability and access to valuable innovation and innovative medical products could be reached while respecting, of course, the principle of subsidiarity and the competences of the member states in the cases of affordability and sustainability of the systems. During this conference, we did a research to see what is in fact the differences between member states and about the access on innovative products. In that time, we examined a basket of 20 innovative medicines which were launched by the European medicines agencies. And we did last year a new exercise to see if there is evolution. And I mentioned already the Access of Medicines Index. Probably it's something we should develop also on the European level. As you know that the difference between the GDP of member states, the lowest one and the highest one is 1 to 6. We see that when we are confronting here for a basket of 10 innovative medicines, it's not the new medicines which are launched. Now we have made a basket based on added value and based on cost effectiveness. We see that there is not a difference of 1 to 6, but 1 to 39, which is, of course, amazing, which is, of course, giving a problem. Mr. Barroso was already mentioned, and don't saw him yesterday, but he said, nevertheless, in his State of the Union, that the sense of fairness and equity between member states is being eroded. And without equity between member states, how can there be equity between European citizens? And there are some initiatives which are running and which are also supported by the European Commission. We have a framework on clinical added value of orphan drugs. There's also the MOCA initiative, which is a mechanism of coordinated access to orphan drugs, which is launched in the framework of Commissioner Tajani's project, but also supported by DG Senko, and which try to find way outs and to understand how we can reach more access to orphan drugs in Europe. Next slides. The report was published at the end of April. You can find it on the website of the Commission. There was a consensus that there is a lot of added value of cooperation between member states, stakeholders, and as far as they are supported by the European Commission. Last week, the preparation was made to launch a pilot and to identify eligible drugs and to set common steps in assessment and appraisal procedure. This group developed also a transparent value framework, adding societal value to the scientific evaluations, and there is a willingness to further discuss about pricing and financial issues. In this way, I was active in a think tank which was reflecting about differential pricing. Of course, we have not as much as time to explore this in depth, but differential pricing implies that manufacturers establishes a higher price for the drug in a rich or a different price, not a higher price, what is high, what is low, a different price in one country and agrees upon a lower price in other countries where consumer demand is more responsive to price changes and where there is also, of course, a problem of financing in the health system. And the basic objective is to improve equality of access to innovative pharmaceuticals, and this for unmet medical needs across Europe. I think that should be the scope in the first time. It's not a question of introducing a European price as such. We will see which should be the consequences of that. And the idea, we put forward the idea to launch a voluntary code of conduct in which we try to create win-win situations, both for member states, both for industry, and in order to have also common access and tackle the problem of inequality in this field. And I think, as I said already, the scope should be unmet medical needs. It's not only orphan drugs, but it can be drugs in which there's no alternative therapy, and which we are speaking about life and death. Equal prices, and that we see in all countries, imply unequal access. I will demonstrate it very clearly. And when we are talking about differential pricing, pricing should reflect the ability and the willingness to pay of a country, but on an objective way. Therefore, I think we can develop, and we have also done some legal analysis to see if it's sustainable with the European Treaty, to have some soft law approach on a voluntary basis, for instance, on a protocol agreement between industry member states supported by the European Commission in a recommendation or another instrument. What are we talking about? Orphan drugs and medical needs, but valuable medicines in general, which are medicines in which there is no doubt about a high added value, which are responding, as I said already, to unmet medical need, and where, of course, market authorization is granted. We could use a like-for-like principle in that sense that, of course, there should be transparency in the ex-factory price. It was also put forward by the patient review analysis, with an acceptable return on investment in order to have, of course, also the reward of innovation, which probably some confidentiality of net prices, but with also price differentiation on an objective way. This way should be an equalizing mechanism, which could be in a first time a clustering of countries with similar GDPs, which is now linked to the percentage spent on healthcare in order to prevent free riding, in which there is sufficient problem of prevalence of some pathologies, and in which there is also the willingness to pay. As Mr. Coates already said, okay, it's amazing that we see that the timeline of launching medical products across Europe is very long, and normally the pharmaceutical industry is starting in high-priced countries, which is normal, but it takes a long time before we find these products in the other market. Nevertheless, access is also a question of public health, and why can we not have reflection and thoughts about transparency of timelines and transparent market entry plans. Of course, setting prices, setting the amount on which the differentiation would take place should be made on appropriate way and by a third trusted party in order to get sufficient trust. One of the elements of differential prices is, of course, that we are confronted with external reference pricing, in which each country is referring for prices to another country, organizing as the race to the bottom, and, of course, launching some problems. And you see here in a scheme that, of course, the high-income countries are lowering their prices, for instance, by reference pricing, but also due to parallel trade in the low-income countries, because pharmaceutical companies want not to undermine their high-income markets. Of course, they are applying other prices, which is leading to less funding for research and less access for developing countries. Next slide, please. It's difficult to read, but it took out of the study of Guido Carone and Anna Xavier about the cost containment policies in public pharmaceutical spending. They did an analysis, what should it give when, for instance, these 10 countries should save the money when putting the price convergence on the European level. And you see it, for instance, in some countries it would be reach high savings up to 22%. In our country, Belgium, it should be 6%. But when you see the second part of the graph, it's another thing, because then you see that Poland, Romania, Lithuania, and other countries should pay more than 40%. It's of a general basket. Of course, it's not the basket of 150 products, I think, but that's what we are leading to in the long term, the race to the bottom. I think external reference pricing should not be applied when you are introducing schemes of differential pricing, or, of course, member states and stakeholders taking part of this framework should agree to limit external reference and pricing to the other member states of a comparable income. The second element is parallel trade. Of course, parallel trade is not adding value to the internal market, especially not when it's going to pharmaceuticals, and it's, of course, one of the problems industry is tackling with, that cheap medicines will be introduced and exported to other countries. Therefore, of course, the internal market principles have to be respected. Nevertheless, when we could demonstrate that due to parallel exports, we are confronted with problems of public health and lowering access. I think we should think about introduce the possibility of some exceptions which are already done for export bans, for instance, but I think we should have a discussion on a more appropriate way. And the last time the Commission expressed himself about parallel trade in pharmaceuticals was about 10 years ago. I think we should review also what's happening on that market. Transparent market entry plan, I said already. This, in fact, we have developed, but we have not sufficient time to go into depth. I think it's important that we can have a discussion on, also on a political level, in order to examine this idea. There are tasks for the high-level group. I think it's important also to have some conclusions and to have some concrete proposals which can help to tackle one small issue, but an important one, I think, of inequalities in health. I thank you.
Thank you very much. Thank you very much, Ron. And we, after the last panelist, we will have also our discussion. I would like from now to welcome my dear colleague Alois Peterle from Slovenia. He is very active in the healthcare area, especially in the fight against cancer. But before this, we have Madame Natalie Chase. She is going to share, she's from the DG Sanco, the European Commission, head of unit, and she's going to share with us some thoughts about what does the EU do to reduce health inequalities in the new member states. Madame Chase, the floor is yours.
Thank you very much. As I'm head of unit for the unit dealing with healthcare system, yes, I will focus my presentation mostly on the healthcare aspect. Also, I think of the speaker, I said before, if you want to reduce health inequality, much more can be done outside healthcare system than within. You have much more impact if you act on housing, on living conditions, working conditions, health determinants, and I think it's really important to keep that in mind. There is so much healthcare system can do to reduce inequalities. But it can help, at least mitigate, and that's what we're going to look at the moment. The other thing I wanted to say is that health inequalities, you have called your conference what we can do in the new member state, but health inequality is a challenge for all. I think we used to say they are not a fatality, they are not unavoidable, you can reduce them, you can act on them, but unfortunately they are very stubborn, and they remain also in what you call the old member state and within member states. So there's a lot to learn, but it's not just for the new. But okay, look at the map, and yes, it is clear, the facts being the facts, if we have but even more challenge in the new member states, for sure. This gives you a map based on the life expectancy. So what can we do? I think the first thing is it's difficult to take the topic globally. You need also to divide, to look at the specific indicators. So here you have 3 different sets of indicators. The first one is life expectancy. And I've taken average, blue, and Romania, Bulgaria, and the EU27, the worst of the EU27, let's put it like this. But you have to look at life expectancy, but also look, for instance, second one is infant mortality. Here you look and you can act on this part with the healthcare system. You can reduce infant mortality if you see this is where the problem is. So it's very important, just wanted to flag to look at specific indicators as well. Here you can see Romania, Bulgaria, they are much above the average and 4 times worse than the best performing country, which is Finland. So there is possibility to act, look at what can be done to reduce this bad performing indicator so as to reduce inequalities. But to do that, then the last columns, they refer to health expenditures, because of course there's so much a system can do without financing, and it is also quite clear that there is a big gap in member states in the share of GDP dedicated to health care, and you can say that below a certain level of financing, probably it's more difficult for the health system to correct a certain level of inequalities. So just to say, it's important to divide And it's important to look at indicators, but sometimes they are not really positive at the moment. This is indicators about access to health. It's a survey, the civic data. It is self-reported unmet needs for medical examination due either to financial difficulties, you cannot pay for your healthcare, or distance, or waiting times. And you can see here that okay, the blue is the EU average. Okay, some member states are performing worse than others. These are all what you call new member states, so it's not a fatality to be above the lines. You can improve, but we see probably there is necessity to act because there is no major improvement in general. The lines are relatively stable, so maybe this call for better action and more thinking about how to improve. Yeah. Maybe next one. This another example of how we think it's important to look at inequality within the healthcare system. So yeah, I've taken Bulgaria because of the audience. I could have done the same with any member state. You can give a recommendation to improve to all member states, so don't take it. But it's very interesting. You look at the challenges. You have to look within each health system, and I think this is very important that there are own challenges. In Bulgaria, our analysis shows that there are inequalities in access to care due to differences between urban and rural area, which is very common for most member states, but also due to economic resources. Also, we know there are difficulties with the funding and financing of the system. How hospitals are financed creates difficulty. There is over-dimension of the hospital sector and a lack of human resources strategy. This is something where we're trying to help member states currently. We're launching cooperation and joint action in order to improve the planning and the strategy on recruitment, retention of human resources. We know we have a very shortage of human resources, health workforce in Europe. We know it's worse in some member states, and the lack of good human workforce makes things worse for your healthcare system. So you will increase inequality if you don't have enough doctors, nurses, healthcare assistants in your system. So this is something where we really try to promote, cooperation, good practices on better joint planning and joint work to avoid what will make things worse. If on top of difficult financing, which is the current result of the crisis, you add difficulties in increased shortage of human resources. Yes, maybe I move on about what we do. So now I've talked a bit about what we see, now a bit of what we do. The previous one, please. The first thing, because before there was I heard a speaker saying that it's important that it's not Sanko enterprise, but everybody together. Actually, the Commission has just adopted a recommendation to individual member states. Within the new economic governance, the European semester, and they will be soon adopted by the Council, I think. Most people look at it as economic governance, debt, but it's also about structural reform. It's also about our recommendation to member states to improve. And part of it, we see we've made very specific recommendations to 2 countries, Romania, Bulgaria, on improving access to healthcare. So this is a commission globally and the Council telling some member states, if you have an issue about access to healthcare, well, you need to reform, and this is our recommendation on how to make things better. So this is one way to reply to the speaker who said it's not only one DG, but here it's a whole commission globally, which noted the problem of access to healthcare and recommend to member states to improve the situation. How to do that? We have the useful traditional tool. You are probably all aware about this. We have the structural fund. It's quite important because at the moment, the member states are negotiating what we call the partnership agreement. So we are negotiating with the Commission the priorities for spending of structural fund until 2020. So it's very important because if member states, in order to reform the healthcare system and to improve access to care, they need some funding from the structural fund, the regional fund from the EU, it's the right moment to ask for it. No, in 2-3 years' time might be too late because if it's not in the agreement, it will not be available. And of course, we had the communication on health inequality, we had a report, and we have a joint action on health inequality, which it's a tool whereby we support cooperation between member states. Now, coming back to your idea that was suggested before of the partnership, it is not the same thing. Here it's a cooperation between member states only. So it's a very different tool. For instance, we had a very different animal. exercise, which is an active and healthy aging partnership, which is very based on multi-stakeholder participation and very bottom-up approach where region or stakeholder come and make suggestions on proposed project or best practices. So this would be a different, maybe a complementary process. Here, the joint action is really traditional cooperation between member states. We do not really have that tool that you were suggesting. And so we have, of course, consultation of stakeholders, but not really a partnership. Yes, I'll continue. So what I wanted to say, because before you spoke about access to medicine, for us what matters is also the broader aspect. Medicine is definitely important. But we need to remember that it's about equal access to high quality of care. This was agreed as one of the values of the health system by the Council of Health Ministers in 2006. But still, you can see it's not yet absolutely clear what can be done at EU level on this. What have we done, really? We notice there is no equal development of quality of care strategy in different member states. There is not much information either on who does what and what we really mean with this. Patients are not very well informed about the quality of care at home. They don't really assess, understand. We had a survey, we made a survey of patients, and it was very interesting that 26% of all patients think healthcare is worse at home than anywhere else, but it's equally. So it gives you an idea that there is a perception problem from patients as well, and it would be very useful and interesting to ask what is their concern about quality, how they understand quality, and how we can improve quality with patients as well. So it's one area of work where it would be interesting to have also some feedback on how to improve. Yeah. Pricing of medicine is an interesting area. I knew you were going to talk before me. This is why I mentioned it. Currently, let's say there is not much transparency. It's competence of member states. Each member state discusses and negotiates the prices. What we can see here is that it is true there is no transparency on pricing, and there is not even transparency on processes to set the pricing. It's quite complex, including for us, to be honest, to follow everything happening in the EU and who does what. You have different methods for setting up prices. You have country with volume price agreement. You have a country with a system of rebate. If you go above volume, you have to reimburse. So we don't really know. I mean, it's not like we, Commission, we need to know. I think member states do not really know how the others are setting prices. There is the issue of external reference pricing, as you rightly mentioned. If a country set up a price is in the basket of another member state, like the system is that your price depends on the price in another member state. So if that first member state set a price very high, you are stuck. I mean, it has an impact on you for sure. But that first member state will not ask your opinion before setting the price. So it is a fact that there is an impact. And I believe there is no real transparency and cooperation at the moment between member states on this issue. So the question is it interesting, desirable? Is there a way to achieve this? Before going up to the level of differential pricing and that pricing that negotiated with industry, because here I think having transparency on ex-factory price would be quite a challenge. But even the first bit, I agree. I certainly agree with the comment that member states are responsible alone, but what they do has an impact on their neighbors. This is true as well. So would the neighbor want to remediate, find a solution? I don't know. It's for member state to say, but definitely you could improve transparency and mutual understanding of the process. So without a big example of what could be done to reduce these inequalities in access to healthcare, as I said, traditionally we've looked at inequality more in a social determinant part. We have not looked at it so much at EU level in the healthcare, except through making individual recommendations or providing funding, but not really in a cross-cutting manner. So it's still an open question, and we would be interested to see whether there is an interest from, if you set up a partnership, whether this partnership, multi-stakeholder, could think it would be an interesting avenue. Thank you very much.
Thank you very much, Madam Chase. And now we can close the second session and go to the most interesting and important one, I think, exactly to see how this multi-channel, multi-stakeholder platform, what we would like to kick off today, will work. I would like to invite my colleagues, especially I'm very honored that Madam Antonia Parvanova is here, and I thank you very much for your joining us. Please come in front. Madam Parvanova is, maybe I can say, so Mrs. Healthcare in the European Parliament. She's very much involved in the field, and so we have in front Mr. Peterle, maybe he's Mr. Healthcare. So we have prominent members and colleagues who are working for years in the field of the healthcare in Europe, and what we discuss here, this multi-stakeholder approach, how to generate and create some ideas which we can use for engaging the European Commission, other stakeholders or decision makers to use the European integration and European solidarity to reduce this health inequality and equal access to health care. So I also like to welcome our friend from Greece, Nikos, and give the moderation to you. And we can start immediately. The floor is yours.
Thank you for the invitation. And I come from Greece. I'm the chair of the Association of People Living with HIV and former chair of the European AIDS Treatment Group, and I am also representing the European patients on the management board of the European Medicines Agency. I think we have heard from the two first sessions, we have established that the health inequalities is not an issue which affects only the new EU member states. So I think that this is the first conclusion that we have reached. What we've also heard from the representative from the Commission is that this has been identified and already some initiatives have been undertaken. We've heard from Mrs. Denislava Dimitrova, the former Minister of Health of Bulgaria, of the initiatives the WHO has been undertaking. And we also have heard from Jutta Koch of the issues around how differential pricing and the new paradigm for coordinated access to orphan drugs has already indicated some solutions. So I think what we have to do now in the next 10 minutes that we have left is to hear from all of you of what you think and you feel are concrete actions and initiatives we can undertake across all stakeholders. And of course, I will first invite our members of the European Parliament to tell us what is their view, unless you prefer to hear first from the audience, from the participants. Do you prefer? Okay. So are there any concrete proposals that can come from people who participate here today through your work, through your whoever has an idea, please raise your hand and tell us where you're from. Please.
Yeah, it's me again, Achim Kaus from ELPA, the policy director. I think because of all the discussion, we really have to think about an instrument that we can see, okay, how much money is really spent in the healthcare system, and maybe how we can really reallocate the money in that way that we can save money. Because we know if we really look into the government or in the Ministry of Health to all the different countries in Europe, we see that there's some money is wasted because of not well coordinated, not well invested, or maybe just because of wrong lobby. Let me say it in that way. And we, the Liver Patient Association, has initiated, I think, a very strong instrument. We have collected all the best practices around, just focus now on hepatitis, but at the same time, we have also established an instrument of to evaluate how much money a country has spent specific for hepatitis and how much money is wasted. And so we can give international recommendations to a country to say, okay, you can save around 20 million each year if you do it like that way, and that way. And I think this is also something that I'm missing in the discussion, that we need an instrument, how we can reallocate the money in a proper way to be used.
So that would be an observatory where we can have all the figures of how money is being spent and see whether we can have efficiencies. Yes, please.
Thank you very much. Благодаря, Andrey, for this opportunity to speak about health inequalities. People don't like them, and MEPs as well. And this is a promising fact. People don't like to be punished because they were born at the wrong side of the line, let's say so. And we speak about the Iron Curtain, especially in Europe, especially when we speak about cancer. And I think that when we speak about money, we don't, usually we say more, we should put more money into research, innovation, and so on. But I think that we could spend less money in a very efficient way if we were able to use the existing knowledge we disposed with. The knowledge is simply not shared. The fact that you have 60% less chance to survive in one of the new member states than in the neighboring old member state means that the knowledge is not there, simply is not there. No? I know how important is research and innovation, but we know a lot in order to do much more. And in some areas we need just better coordination. In some areas I would say we need just information, what the others are doing. No? We don't need to triplicate the same research here and there. And I think that maybe there is not the first question how much money, but for what, for which purpose we use it. There is a European Partnership Action Against Cancer, which did not get a lot of money, but I think it's quite a good approach, which is aimed at better coordination of the member states. And I would like to stress also that patients are not interested whose competence is health, and it's whether this is member states or European Union's competence. They simply wish to be cured in the best possible effective way, of course. And inequalities are that area which can only be covered by the European Union, because no individual member states can deal with inequalities. Member states cannot be responsible for the neighborhood, let's say so. So this is the reason why we need some money to do necessary projects or policies at the European level, indicators, recommendations, common projects, coordination, and so on. And I think that MEPs here can play a very important and effective way. We are those who, everybody from us is from somewhere. From Bulgaria, from Slovenia, and so on. So, and we can bridge this distance between Sofia and Brussels, or Ljubljana and Brussels. We can do a lot. This has been my experience in Slovenia, but I appeared also in Bulgaria a few years ago in fight against cancer. I think we can do a lot also with our own personal example, let's say so. I'm a former cancer patient. 10 years ago I was diagnosed with cancer, and I survived. I'm pleased. I count from zero. I'm 10 years old, I would say. But I think that with a little bit life or heart for that, we can do a lot without special funds for our endeavors. I think that it was enough for because we were told that we only have 10 minutes. So.
Yeah, thank you very much. Please.
One few sentences also from my side. Again, thank you very much, Alois. And maybe we can, I can do it now formally to say that we are going to create still in this, or to establish still in this legislative period, one informal group exactly on this equity of access to quality healthcare, to give also possibility of MEPs to discuss the topic, and for sure to make it more visible for the colleagues, but also to engage the European Commission more strongly in this field. And I'm trying to engage also colleagues from the old member states. From the new member states is more easy for the moment, but this is a topic which is important for the whole Union, and despite of the crisis, despite of the debates on the multi-annual financial framework, we should not forget this, and still in this legislative period, especially for the European elections, where I know from the patient organizations they will have also some requests to the European political parties in the field of avoiding or overcoming the health inequality in Europe, to kick off such an informal MEP platform where also the stakeholders can participate, to give the possibility of generating the possible solutions to overcome the inequality of access to healthcare in Europe. I will welcome very much if also my dear colleagues will join this, I know, at the end of the mandate, but still we have to prepare for the new colleagues to come next mandate, also a platform. Please, Petru, please come in front. Here's a place also for you. Again, our colleague who won the award of, in the field of health this year, 2013, and Madam Antonia Parvanova, she was MEP of the year 2012. Oh, no, 10. Oh, sorry, 10 in the field of health. Please, maybe you can also share your ideas and observations.
Thank you very much. Welcome to everybody. First, I do apologize. I'm not in my best shape because today I'm less MEP, more a patient, but I'll try to do my best. It will not soften my radical views anyway. Which I would like to share with you, and I am absolutely sure that there are many people which will join me in this. It's excellent to talk about inequalities. It's excellent to have steering groups, committees, stakeholder sessions, seminars, or all kinds of platforms, think tanks, etc. But I think there should be a very ambitious goal. And only by setting such a goal, then we can achieve something. And I will propose you a goal, not just variety of goals or alternatives, but one single goal. And this should be a change of the treaty to involve or to include health into the treaty and to have full competences of the EU institutions on health. There are enough evidences. It may shock some of you, but I have been on this position for I don't know how many years, since I'm born as professional. But there is strong evidence, and here we talk about health inequalities in the health status of the population, but there are inequalities in all possible areas. There are inequalities in access, there are inequalities in health, in quality of care, there are inequalities in treatment, there are inequalities in the way diagnoses have been set, there are inequalities in the healthcare premises, there are inequalities in management of the healthcare systems and the management of the hospitals, if you wish. There are inequalities in all possible areas in healthcare, which means that if we try to continue with this approach by giving the responsibility to the member states and just applying soft measures, we are going nowhere as we are so far. And by having this evidence, there is only one reason to start this discussion: to set up a pressure group, to involve all stakeholders, and to lobby for change of the treaty. They have been 20 years ago, they have been 50 years ago, when many issues in the Union looked quite impossible and quite unresolvable, because the initial idea was, if you remember, it was just steel and coal. Probably at the time of the establishment of the Union, steel and coal were very important, or at least they have been a source of war. But now there are many other issues. 20 years ago, nobody imagined that human rights will be part of the treaty, that the Fundamental Rights Charter will be part of the treaty. Now, why not having ambitious goal to involve and include health into the treaty? Only by having such a goal, we can achieve it. Without having something to dare to think about it, to dare to organize, to dare to grab it, nobody will give it to you. It has not been given to anybody, any of the achievements of the Union. So that's why I very much welcome such establishment of whatever we call it, pressure group, lobbying group, think tank. I don't like think tank very much because it looks to me like this and that, but nothing at the end of the day. Yeah, you just put something from here, and then back, vice versa. But I like something which is more focused straight away. And I'll do my best. I'll dedicate all my intelligence, professional capabilities and expertise into such cause. And I think there will be many people which will support, because now we talk about R&D, we talk about possible investment in new technologies in healthcare. But this, if you invest in a system which creates inequalities, or if you invest in a vehicle which has insufficiencies, you will end up nowhere. It's not worthy actually to paint such an old vehicle, because it will not work, it will not move forward the way you expect it. It will be still with a very spoiled engine. And the engine, the brain of this, the main computer of this system, it's actually a little bit destroyed. And we have to talk about this. So by saying that, I will suggest that we set up a very strong action plan. How do we lobby? What do we do? What kind of evidence we collect? From where do we collect? How do we demand, using all the parliamentary possibilities as procedures and political will, to make some pressure on the Commission or to incentivize the Commission? I'm absolutely sure the Commission will be more than happy to put their finger into this, because they should be also fed up of all kinds of complaints from patients' organizations and stakeholders and everybody that they are not doing enough. Probably the pressure should be used towards the member states. Somehow we have to deal with it. Governments are changing, people are voting, and governments know very well, politicians know very well, that their life depends on the voters, professional life, I mean, or political life at least. So I remember there was the time where nobody believed that we can achieve cross-border patients' rights in cross-border healthcare. But we did it. And do you know how we did it? We just annoyed the Commission. We organized 2 million patients sending postal cards, although we did something quite behind the scenes. We printed the postal cards. We just gave it to the patients' organizations. But they sent it to the Commission, they flooded their pigeon box, and at the end of the day, the Commission said, okay, we give up patients' rights in cross-border healthcare. This was just the first step, and it happened just between 3 people. One of those people is here, just Rostislava. But it was her, me, and one of the presidents of Italian NGO. Patients' organization. So sometimes big things happen with small ideas, but with bunch of very committed people that have to come together and to continue working. This is what I'm proposing. We have to use the possibilities that the Parliament gives us as parliamentarians, all the resolutions, declarations, and to continue flooding, pressuring, etc., the Commission and the Council, until there will be a very strong and serious group set up to observe, analyze the treaty, and to find a solution, and to make a setup or a formula, a setup of measures, how to do it. And this will follow with it also a separate committee on public health in the Parliament, because so far we have a giant, we have something, kind of a monster in the Parliament, which is Environment, Public Health and Food Safety Committee. This is the only committee that has 3 in 1, is flooded with dossiers, mainly dedicated to environment, sometimes food safety, and sometimes also healthcare. But it's very difficult to work in such an environment because you lose, there is a delusion, you lose the priorities, and you don't put public health as high on the political agenda as it is on the personal agenda of each of us or of all the citizens. So thank you very much, and let's work till the next session. I hope there will be a next session to prepare this action plan with all the political measures and pragmatic steps to propose it to the audience and to see what will be the ideas of each of the participants, how they can contribute, how their organizations could join, and how they can motivate other organizations to join such a plan, if they agree. That's my proposal. Thank you.
Thank you very much for this proposal. Would it be correct to assume that then this group of MEPs, which is about to be set up, would assume this as one of the first priorities of things to do? May I invite also Mr. Lujan to give his view on this?
Yeah, thank you very much. There are so many issues we could discuss about, but what's very important is that we have to get all the relevant stakeholders from this field at the same table in order to find common solutions, common concepts. Because we need not only the technical support and research and development in this area in order to find innovative solutions, but we also need financial framework, financial support, and proper legislative framework, which we stand for. We are at this level, and I truly support the idea of an informal group to give you all the relevant stakeholders, again, NGOs, representatives of patients, representatives of pharma industry, representatives of hospitals, representatives of national governments and representatives of national parliaments to communicate to the European Commission and the European Parliament in order to find common concepts, because we have to tell you that from the middle of Brussels, or middle of Sofia or Bucharest or whatever, we don't know all the details from the bottom, from the ground floor, but you do. And that's why there is a huge need to have a proper and efficient communication. And that's why this informal group, which I truly support, and I will be more than open to get as many associations, as many ideas from your side as possible in order to find an efficient way to communicate, and not only to communicate, but also transform your ideas into concrete legislative base, which will be then transferred to national legislations, because that's the way the European institutions and subsidiarity principle works. And in this way, we would have the chance to transform your ideas and your necessities into real legislation, which would be in a benefit of you and your patients, but also all citizens. I always say it's not enough. Maybe we don't pay enough attention to education, because at the European level we know where we should stand in numbers, but also in political views in 7 or 10 years. If you look at the EU 2020 strategy, we see, from my point of view, health is not very high, as my previous speaker said. It's not very high on the agenda. Who is fault? What should we do additionally in order to put it high on the agenda of the European Commission, of the executive power? And maybe we don't know enough about this, but you can now. You have the chance. Through this informal working group, we build and we support at this level to communicate as many details and ideas as possible. So again, I appreciate so much all the speakers, especially the Commission that shows commitment to this topic, which is very important, not only for us, but not only for those who suffer, but also for those who don't. And let's take this as a starting point and work together as much as possible in the future. Thank you.
Thank you. I think one thing that came as a common suggestion is that we should now work together and not just do consultations only, of course, which are very important, but somehow work more in partnerships. So I think that your suggestion in this informal committee to actually institutionally invite members of the stakeholder representatives, that would be a fantastic idea. I think that the Commission has already signaled that they would be investigating of an opportunity to do such a thing. And as we heard previously from Madame Dimitrova, she's excited about a new initiative, which I want to give 1 minute to Stanimir, which is the initiative of EPF, which if you can... and then... 1 minute.
Okay. I'll try to wrap up from somewhere. Thank you.
Come here.
This morning, actually, before entering this room, I definitely felt I, as a schoolboy going to an exam. After almost 2 years working on this initiative and the conference in Sofia and so many meetings with most of you that are here and talking about how we can really collaborate. Now, after this couple of hours spending together, I'm really inspired on all that. And I can tell you that together with the European Patients Forum and Nicola Bedlington, we have quite many ideas to be discussed from now on. What we will do, we will prepare a full report that will be shared with all of you after this conference. Report also from the survey that was done among patient leaders in those 15 countries. We will launch as soon as possible a consultation process with all relevant stakeholders, how we can build real partnership to support the efforts of institutions, politicians, the member states and all stakeholders in order to reduce inequalities and to assure more equal access to quality healthcare in Europe. So I'm extremely happy that we have the first result now, this informal group of MEPs. Thank you very much. We wish you good luck, and we are going to support and observe every single step you are doing, and I hope at the end of the day it will really make the change. Thank you.
Thank you very much also from my side, and I would like to thank to the European Patient Forum and to the National Patient Organization of Bulgaria. And we are continuing to work together. Thank you. Success to all of you.